Hi everyone, Dr. Timothy Gallagher.
Dr. Michael Marciello.
And we're from Maragal Medical. This week we're going to be talking to you about cutting edge treatment solutions for neuropathy. If you're one of the many patients out there suffering from this oftentimes debilitating condition, you're going to want to find out what we can do here with our team approach at our physical medicine clinic. You're not going to want to miss this one, so stay tuned. Okay, so neuropathy. This is a topic that we've talked about in the past to the viewing audience. This is a complicated topic that we see here in our practice. It oftentimes, has a lot of comorbidities associated with it. What makes our clinic here at Maragal Medical different in our approach in treating a patient with peripheral neuropathy?
Well, if we just start the simple aspects of saying, what is neuropathy? Well, if we break the word down, pathology in the nerve. So that's what we're talking about. And most commonly, we are talking about peripheral neuropathy. So there's the central nervous system, which is our brain and spinal cord. We're not going there. We're talking about the nerves that are going to our hands and our feet. And that is why it's complicated. The nervous system has an intricate array of wires, which are really the nerves that go to all the nerves and the muscles and the joints and the ligaments. And so it depends on where those nerves are traveling and how they're damaged. So we have to look at it diagnostically to make sure that the nerve is being problematic from the most distant part first, and then receding or having damage, such as if your diabetes is causing neuropathy, you can call it diabetic neuropathy, where you get burning and pain in your feet. And that's the cause of that person's neuropathy. There are many other causes, but that's why it leads to all these different conditions that are associated with neuropathy, and then some that cause neuropathy, and then really, what do we do about it is the harder question.
Right. And sometimes, we get a patient in, they don't know, and we can't figure out why they ended up with neuropathy. It's more of what we say is idiopathic, but again, the disease progression continues and their function is definitely impacted, and not to mention, the symptoms that we have. So, with our approach, there are some things that we can do to help to repair some of the damage. So how does regenerative medicine play a role in this?
So we're trying to reduce that degenerative process in the nerve or the damage to the nerve. So if we can restore the outside sheath of the nerve, the coating that allows electricity to take place, if we can help restore some of the nerve fibers to regrow into the distant portion in our toes and things, we can add around the nerve itself regenerative injections. And that way there's kind of healing properties to those solutions that result in the nerves improving. Maybe it doesn't grow all the way back to the end portion of your tip of your toe, but it may settle it down, make it the burning pain to settle down, maybe not as uncomfortable, maybe get a little bit less tingling or pins and needles. So we're trying to get rid of a lot of those symptoms by improving upon the nerve function. Then we have to do all these other things too, right? We have to make sure the person's eating right, walking correctly, utilizing a balance machine in order to make sure the damage that may be, although better, is still worked on so you don't have the other complicating factors of neuropathy and loss of balance and difficulty with your gait patterns and all these things that come along with damage to the nerve.
Right. And when we talk about regenerative medicine options, specifically, we're talking about, what are called those Wharton jelly umbilical cord allografts, or commonly known as the stem cell injection. So we use donor source umbilical cord from an FDA approved laboratory, so it's completely safe. And then 30 days later, we help boost the injection with what's called the PRP, or the platelet-rich plasma injection. That really helps just add some more growth factor. Again, we're not looking at to totally heal the nerve, but if we can repair some of the damage and if we can lessen the patient's symptoms, oftentimes that leads to better function and better quality of life. But really, that's the start of it. It's the care. And oftentimes when we're talking about peripheral neuropathy in the feet, we see it all the time, how it affects the patient's proprioception or balance. The Hanover robotics is a great way to focus on their rehabilitation to improve upon that. But There's also other problems that develop. If you have had neuropathy for a long period of time, if you're not moving correctly, the other joints start to wear out, right?
They do, because you stand differently, you walk differently, you put different forces, you may compensate in a way that your back gets thrown off. So all those things that just settle in because we're not really utilizing our body's kind of natural properties to stand correctly and do the things that we normally would have done anatomically. So those nerves are having their troubles, and it's going to reflect in all those mechanical changes. But let's be clear in the aspects. If you're having diabetic neuropathy, if you're having neuropathy from a exposure to a chemical or we still have to get rid of those things. So we have to make sure the person's, if they're overweight, if they're diabetic, that their sugars are being controlled. We have to look at the big picture, and we're going to address those things here in the clinic, because then we can start working on all the services between the chiropractic, between our therapy, because it's a holistic, whole person approach, not just to say, you got a nerve damage and we got to try to get rid of that problem.
Right.
It may have started from somewhere else. We have to address all the medical issues.
Yeah, and the modalities, instead of adding more medications, like something as simple as, class 4 laser in conjunction with the regenerative medicine injections, also, with the conjunction of the chiropractic care, the physical therapy, and under your leadership, just guiding the patient through that process, looking at the patient as a whole, looking at, diet, nutrition, and letting the patient know too that this isn't a one-way street. It's a team approach. They need to do the work as well. And I think what you do such a good job is educating the patient so that they completely understand what the disease process looks like, what all their options look like, because there's no cure for neuropathy, and this has a detrimental effect on the patient's, quality of life. So we're seeing great success in treating those patients that are suffering from neuropathy. If you'd like more information about, what we do here at Maragal Medical, just check out our website at maragalmedical.com. We're a full-service physical medicine clinic where we combine medical care, physical therapy, and chiropractic treatment, and have a special interest and expertise in regenerative medicine. Best of all, folks, we take most insurances. So that was a lot of information today on a very complicated subject. We hope that you've learned something, and if you know somebody that's suffering from neuropathy, please feel free to share the information to them.